by Professor Ramneek Ahluwalia, Higher Education CEO. Prof, good to have you, and thank you very much for your time. There is a national strategic framework on HIV and AIDS having a 20-year outlook. This was launched in 2012. Of course, it continues to be monitored. There is also a strategic framework and policy on HIV and AIDS coming from the higher education sector, which seeks to align with the national strategic framework. One of the things that is looking at are the 4 zeros. So 0 new infections, 0 deaths, 0 new infections due to HIV transmission from mother to child, 0 discrimination. How are you faring since the launch of the framework on those particular aspects in the institutions of higher learning?
Thank you very much, and good afternoon to everyone. We're dealing with a very difficult epidemic or a pandemic in the world. Let me first pass my apologies for 40 million people who have died from this disease, many of them in South Africa. And still, even today, 40 other million people live with this disease in the world. So you're talking about a pandemic of that magnitude. We're also talking of a pandemic which is not a linear pandemic. It's a very complex societal pandemic. It's linked to massive gender-based violence. So you can't fight HIV alone here. You have to fight issues of gender-based violence, transactional sex, poverty. We've seen that education is preventative, drugs and alcohol addiction. So every societal ill, and South Africa being just a 30-year-old democracy inheriting a difficult past, so is higher education, which is a microcosm of a bigger society. The challenges of such a disease, when it enters our nation, with all our challenges, become over complex and over problematic. And the pandemic takes a very severe stage on us as humans and as a country. And as higher education, we have believed that we're not going to fight only HIV here. Yeah. We need to tackle every other parameter that surrounds the HIV epidemic. So you can't win HIV till you not build a good citizen. How do you empower people with education and with skills? Because we know education is prevention eventually.
Yes.
How do we make sure that transactional sex reduces, gender-based violence reduces? How do we tackle drugs and alcohol addiction or abuse? Because 65% of every GBV in South Africa is preceded by drugs and alcohol. Yeah. And gender-based violence is a predecessor of how the HIV infection passes on from one person to the other. Then multiple partnerships, transactional sex, poverty. So I think we're tackling the entire spectrum of these challenges and not just the disease, because we know if we tackle these massive indicators or challenges that surround the pandemic, we'll be able to overcome the HIV epidemic. So we are, as a sector in our universities and TVET, we are very happy and at least progressive to the fact that education sector is preventative, which is exactly how the South Africa needs to be, and keeping the campaigns on, keeping the knowledge and transformation on. And one of the major projects that we have launched is a co-curriculum. Every South African in higher education, whether in TVET colleges, community colleges, or universities, enter a co-curriculum. Yeah. A co-curriculum from civic and soft skills,
right,
where HIV is taught along with other challenges that I spoke about. Yeah. So education is important, and we need to continue that route.
So, as you speak of transactional sexual exchanges, one of the targets would have been, according to, I know you were one of the program directors in terms of a particular unit that was looking at this facility that came up with this framework, was that there needs to be an education given particularly to new entrants across the country, because they are coming in and they have some liberties that previously had no experience in managing, and then there are issues of alcohol and transactional sex that begin to emerge. And the hope is that if you're able to get those new entrants, they're able to be empowered, they have their education, they become agents really for the messages to the community at large, and in return also become agents that come up with other solutions, research and technologies that are required. What's the challenge to that intervention, and is it progressing as would have been envisaged?
We have been. I mean, this is a reality of us. We have vocational institutions in rural and informal settlements. We have historically disadvantaged universities, we have advantaged universities, we have poor South Africans now getting access to our higher education, which is exactly the transformation our country needed. But poverty brings a lot of challenges. Just imagine when it takes that 1 month, just to give you an example, when the new students come in, the residences take time for the old students to leave. That 1 month sometimes can become challenging for a young woman who comes from a very poor household, doesn't have the money, and doesn't get into the residence, and she has to rely on a blesser. And that is how transactional sex starts. Poverty is a big driver for transactional sex. Any older men trying to take advantage of young women just because of money transaction for her to survive, to give her a place to stay. These things become so. I think our ability from that framework is still today is to keep on pressing the issue of faster access to residence. That's why we're happy with NSFAS now giving absolute money on allowances to our young students, trying every possible way through government, through systems, through education, try to tell a young woman it's going to be difficult when you are trying to change your life. Remember, the aim is for this girl from township to buy her an apartment and eventually her own life to begin. And that can only happen if she finishes her studies. So that period of studies and leaving a home, coming, it can be challenging. So I think we are working on that system in order to protect that child that is highly vulnerable to transactional sex and many more challenges that leads to HIV.
Yeah.
So I think, again, as I said, we can't leave the framework alone on a particular reason. There are multiple jargon of things that we need to tackle together. So HIV cannot be one alone without not tackling everything together.
Yeah. On the question of limiting, because the study that you would have conducted, for example, as you put it, would have shown that tertiary education itself is a protection. Those with tertiary education, the odds of getting the HIV virus become less, even though, of course, the conditions that lead to HIV infections are similar for those in tertiary institutions. But there was a revelation around support staff, in particular in institutions of higher learning, having a higher prevalence of HIV. How has the treatment of those particular individuals been carried out in institutions, ensuring that at least those who are eligible for treatment get the treatment and are not dying because of lack of treatment?
We're very proud to say we were the first sector in Africa, not even in South Africa alone, where we are still running a campaign for 15 years called First Things First. And what was that campaign was exactly the motto of the 2024 World AIDS Day. The first priority of every South African is to look after their health and well-being. And what we did was, like you go to employers, like big companies, the discoveries and the big medical aids will do wellness days, bringing services to the people on that day. In Europe, working in Newzroom Afrika, there'll be wellness days also. But for the poor, we have to ensure we do it for the young students who are coming from poor backgrounds. So what we do is every month, twice a month, we have a wellness day for every South African in the post-school education. And very grateful to the vice chancellors, the principals of the colleges for giving us. So that not only the poor South African students, but also our staff, support staff, which also comes from very historically disadvantaged backgrounds, they come in. Now, this is for everything, diabetes, hypertension, HIV, not to stigmatize a particular disease. However, access to treatment, medication, access to health services, access to dental services, everything is brought to the vicinity. So I think the innovation of bringing health close to the community changes the equation. And similarly, bringing ARVs onto our sites. We are very proud to say 20 of our 26 universities are now ARV accredited sites, which means you can get your daily ARVs from the institution itself, which means you don't have to miss your exam, you don't have to miss your work, you don't have to go and stand in the Department of Health. Once you have been put on treatment, once you have access to treatment, you can get your treatment from the site. So I think that's the revolution other sectors need to also put together, is because that will change one of the parameters of how to tackle this disease is to bring health access to community. And I'm very happy that the current World AIDS Day theme is about your own health is your own life. And that is exactly what we must be doing.
A holistic approach, you're saying, is what is needed, at least in the implementation of these policies and frameworks, that not only deals with the virus at the stage of infection, but the causes that lead to that. What do you think then would need to be strengthened? One, in the area of capacity, in the area of systems, in the area of structural changes in order to respond to the epidemic effectively?
Our country will be only able to come out of this pandemic if we stop new infections. There is no point people becoming positive and then we putting them on treatment. One, we are losing a young life. Secondly, it's also a burden on the states to find always investments to spend on treatment all the time. So prevention is what our nation needs to put our efforts towards. Systemically involving our communities, our nation has done very well. Despite all the challenges we inherited from a difficult past, but we need to be together in this fight, which means how do we ensure that our communities can be away from drugs and alcohol? How do we increase more employment in our country? How do we continuously put the efforts towards gender-based violence? How do we ensure that we are being absolutely looking at every life from a microscopic perspective? And for that, I will always say education is prevention. Every South African, primary school to secondary school to a tertiary education, needs to do the co-curriculums on HIV, on gender-based violence. We need to build skills in our communities to be resilient against these pandemics. And education will be our biggest battle. As President Mandela always said to us, that education will empower this nation away from any other challenges. So I think I will treat the education route. I will go and plead to all our schooling system, our family systems to not stop the word education and build a nation where resilience is built through education by informing them of everything. We think people know, but there's a lot to be taught about them. A young woman who falls into prey to a transactional sex, at least be aware of from the beginning that what are the harms to it, how she can be resilient to fight it for a while, for a future that she cannot destroy for herself. How can we stop addiction, abuse in our systems of drugs and alcohol, because peer influence is very high. So we have multiple challenges, and we can only do it by systemically conquering each of them, and automatically we'll start seeing our HIV epidemic start coming down drastically.
CEO of High Health, Professor Ramneek Ahluwalia, we appreciate your time and thank you very much for your intervention this afternoon. When the Newsfeed PM continues in a short while.